Cathy Creswell, and I'm a Professor of Developmental Clinical Psychology at the University of Oxford. I lead the National Institute of Health Research, or NIHR, Oxford Health Biomedical Research Centre, or BRC, Mental Health in Development theme. The NIHR Oxford Health BRC is run in partnership with the University of Oxford and involves over 13 additional partner universities and NHS trusts across England. It supports the development of mental health research infrastructure across 11 research themes. Our theme, Mental Health in Development, aims to advance understanding to ultimately benefit children and young people's mental health. Our team includes researchers from various departments across the University of Oxford, Oxford Health NHS Foundation Trust, and the Universities of Liverpool, York, Reading, Oxford Brookes University, and the University of Birmingham. Many mental health problems begin in childhood or adolescence, and in recent years we've seen an increase in the frequency of these problems. Many of those affected do not receive professional support or interventions, and there are mixed outcomes for those who do. Our end goal is to develop targeted, effective, and accessible mental health interventions that meet the needs of diverse children and young people aged 0 to 18 years. Our team actively engage with children, young people and their families and communities to improve understanding of their needs and preferences. We aim to build capacity to improve awareness and understanding of the mechanisms which underlie common mental health problems in children and young people. These could be biological, social, or psychological, and to translate this into more targeted, effective, and accessible prevention and treatment. Our theme comprises a number of overlapping work packages. The Insights team focus on innovation in involvement and research methods that prioritise the experiences of children, young people, their families and communities. This team is co-developing innovative research methods and participatory models of engagement with children and young people, their families and communities to capture diverse views and experiences by applying methodologies from social science, humanities, and the creative and performing arts in order to develop approaches for meaningful involvement in the design, implementation, and translation of mental health research. The Adaptive Innovative Measurement, or AIM team, are co-designing tools to identify and modify mechanisms that underpin the onset and persistence of common mental health problems among children and young people. A priority is the development of digital tools that can be administered at scale and across ages. Our third work package is focused on establishing ongoing partnerships and embedding research into settings such as early years services, schools, and mental health clinics. Here we have 3 different teams. The Supporting Early Minds Research Network, which is developing a network of early years services and professionals who are engaged in mental health research relating to children from infancy to 5 years of age. The Wisdom Research Network are developing networks of primary and secondary schools who are engaged in mental health research. Finally, the Oxford and Reading Andy research clinics are working to integrate research into clinical services for children and young people aged 5 to 17 years. Oxford Andy is a new research clinic which is building on the success of the existing Reading clinic in partnership with Oxford Health NHS Foundation Trust. Across all of these networks, we're working with early years services, schools, children, young people and families as potential research partners who have the opportunity to inform future research, participate in research and use the findings of the research. Our final area of work focuses on national engagement and collaboration. This is in partnership with colleagues at the University of York and Liverpool, who are leading major birth cohort studies in regions that experience marked inequalities, such as the Born in Bradford, Age of Wonder and Seagull studies. These studies provide opportunities to identify target mechanisms for intervention and to develop interventions working alongside the AIM and Insight teams, and then to test these interventions in various contexts through the Supporting Early Minds and Wisdom networks and the Andy research clinics. Patient and public involvement, engagement and participation is at the heart of all of our work. Through our new Parent Carer Research Network, in partnership with the Charlie Waller Trust and our partnership with the University of Birmingham and their Youth Advisory Group, as well as with our wider community engagement, We are co-developing resources and interventions, and we strive to ensure lived experience is at the heart of everything we do. We hope this has explained a little bit about our mental health in development theme, but you can find further details and information on our website.